All right, our next speaker is Lucia Kaiser.
Thank you. It's a very great pleasure to be here today, to see old friends and colleagues, and to be able to present on this topic, food preferences of racial and ethnic groups in the WIC population. Okay, so for a program that serves the 50 states, the tribal lands, island populations, not surprisingly, the ethnic racial profile of WIC is quite diverse. And this slide shows in data from 2012 that 52% were white, 19.8% were African American, 12.2% were American Indian or Alaska Native, and 3.9% were Asian Pacific Islander. But in a separate question that asks about ethnicity, 41% of the WIC participants also report that they are of Hispanic ethnicity. So today I will be beginning to present a little bit on this topic. The task was challenging, I found, because the data are sparse. The findings are sparse when you try to understand how subpopulations in WIC are faring, especially looking at food choices of these populations. So I think what I've decided to do was to give a review of some of the peer-reviewed studies since a little bit before 2009, applying more of a cultural lens to that review. And then give you some insights from some of the California WIC populations that we've been working with in California, a few perspectives from other states, and then end with some final thoughts. And I felt on this, not only was I applying the cultural lens as shown in the cartoon, but a little bit of sleuth in trying to find to tease out what we're learning. So, to learn more about the food choices of WIC participants, a study was conducted in the Maryland WIC program in 2007. The ethnic racial profile was 39% white, 35% African American, and 18% Hispanic. And again, this was done before the rollout of the new packages. And there are many interesting things, but what I pulled out here is a chart that I recreated showing the percent of the population reporting consumption of different types of milk. And you can see here the African American population in this study reported no consumption of low-fat milk, which was significantly different from both the white and the Latino populations. And all groups were reporting much more whole milk than they were consuming of the low-fat milk. In the survey, they also asked participants about would they buy more soy, would they buy more tofu, and there were, a good percentage that responded yes. And I think that's interesting because I think the way it plays out after the fact is fewer people are selecting those options. So even though states endeavor to try and understand through these surveys, it may not be as predictive in the final analysis of what people will buy. Now, this study is a study from the Texas WIC program, and the purpose of this study was to look at differences in food choices across urban and rural areas of the state in the same population, in the African American population. And this was also conducted just before the voucher rollout, I think in preparation for being able to monitor changes that would happen after the new packages were implemented. So it was conducted in 2008 and 2009. Now, the initial analysis they did suggested that there might be more variety in the urban areas in the diet. The diet was assessed by a questionnaire. But once the multivariate analysis took into account some of demographic characteristics, those rural-urban differences disappeared, and there really was no effect of rural versus urban on the variety or frequency of foods consumed in this population. It also has listings in this article of the top 10 choices that women were making and for their children. As you can guess, there's a good overlap between what mothers are eating and what their children are eating, and you can see quite a rainbow of different colors of fruits and vegetables that was selected by this audience. Now, in California, just 6 months after the rollout of the new WIC program, we conducted a study in cooperative extension in the WIC clinics in 3 counties. And again, what I'm showing you here is a little bit different, a different look at rural versus urban. One of the counties was Tulare in the Central Valley, which has a predominant Latino, Hispanic population. And then we had an urban area here to showing you in this slide, which was the Alameda area, Bay Area, where there's a larger percentage, I think maybe 25% African American in that sample. But what was interesting, I think, here, we asked people about some of the decision-making process related to which foods they were buying with their cash value voucher. How important are the following reasons in choosing which foods? And they could answer for each of these separately. So what I found interesting here was the top choice, top reason that was ranked across both areas was the freshness and the quality of the produce. That was what they decided on which ones to choose. And then you can see that family and personal preferences of the mother also played in fairly heavily. But whether they were on sale, the price, or whether people needed them for a recipe were not as important as the freshness and quality of the items. Now, I want to also mention that we asked them what they did buy with their fruit and vegetable vouchers and what they would buy if those were available in their stores. And interestingly, in the African American community, some of the ethnic vegetables, the collards, the mustard greens, were not purchased as much. But when we asked them the second question about what they would buy, about 3 times as many people said if those were available in the stores where they're shopping, they would indeed buy them. Now moving to, again, more studies that are after roll-off, and I know some of you are very familiar with these studies. A few begin to shed lights how populations have responded to the changes. This is a statewide study that was done in California before rollout in 2009 and 6 months later post-rollout. And in California, the population that was served was 79 to 80% Hispanic, Latino. And some of the findings, these were snapshots at 2 different times, not the same people, but 2 cross-sectional snapshots. A decrease of whole milk, increased intake of lower fat milks in both the women and children, increased whole grains, but there were mixed results on some of the fruit and vegetable findings. And interestingly, they also reported that their Spanish-speaking audience compared to English speakers reported more satisfaction with the package, particularly the whole grains, lower fat milks, the amount of cheese, amount of juice, a little less satisfied with the amount of milk. Now, in California, many of the English speakers are also Latino, maybe more than half. So this might be an indication that acculturation, the Spanish-speaking Latinos being more recently arrived, perhaps less acculturated. There might be acculturation effects within ethnic groups that influence how they feel about the WIC food packages. Again, another familiar study for you, but I think this was very interesting, a longitudinal study that was done in the Chicago, Illinois area that looked at before the rollout in 2011 and then followed up 18 months later. And this study was able to look at almost roughly about the same number of Latino, Hispanic, and African American mothers and children, which enables us a very nice side-by-side comparison of how these groups responded. And overall, they found interesting the greater changes in the children than the mothers in diet, and greater changes in the Hispanic group than the African American children. Reduced fat milk intake was increased in the children, and decreased whole fat milk intake in both children and mothers, and decreased juice. So you can see that there's some differences between children and their mothers and across the two different groups. There was an increase in sugar-sweetened beverages reported in the African American children, but we don't know really if that would have happened anyway, because it wasn't possible to have a concurrent comparison group of people on the old package to see if this is an age-related change in that population. But they did not report any effects on fruit or vegetable or whole grains, and suggested that perhaps the cash value voucher value might be too low, might need to be increased to see an effect. And that was also commented on in the California study as well. And just to give you a little bit more colorful look at this, of the groups that we're targeting to try to change, whoops, I'm a little too fast. Oh, my goodness. Okay. That we're trying to change, increase more fruit, more vegetable, more whole grains, and low-fat milk. You can see summarized here that the only significant changes from pre to the 18-month follow-up were for the children, increasing their intakes of low-fat milk. But you can also notice, if you comparing the size of the bars, basically, that there are differences across groups in their consumption of these food groups at the 18-month into the new food packages. So since the data on the fruits and vegetables were mixed in the WIC food package, it occurred to me that I have some data from California that hasn't been published yet that might be interesting to share with you. We're in the midst of doing a obesity prevention project, a 5-year study funded by USDA in the Central Valley. This is a Mexican origin population with children ages 2 to 8 years at the beginning of the study, and we're in the 4th year of it. At baseline in 2012, you can just get a sense of what was in the study. We had, the population is very poor. 88% are below the 130% of federal poverty level. 95% of the families would be eligible for WIC, although at this time only 76% of them were enrolled. Food security is a very severe issue in the Central Valley. 51% of the families reported low or very low food security using the 18-item tool. And at baseline, 46% of the children were overweight or obese. Now, this is an intervention study that provided nutrition education to the families, nutrition education through our cooperative extension in the schools, physical activity, and the intervention group got $25 every month in a fruit and vegetable voucher. To avoid confusion with the stores in that area, we kept the foods allowed aligned with the same foods that were allowed by the California WIC program. So this allows us to see if we increased the option of a higher value in the fruit and vegetable voucher, what would people buy? And this is very preliminary data. I have a couple of postdocs who have been working with us. But the way this worked, the families went to the store and they had a loyalty card that they scanned, and we were able to take scanner data And at this point, this is only the scanner data. We're collecting receipts, so we'll see eventually about other food purchases. But this will just tell you the categories of what they spend. And with a $25 voucher, and they were spending on average in the January of 2014, $26. They paid a little bit more out of pocket, and in July it was $28. But in both months, the biggest category of expenditure with this addition is the fruit category. There was significantly more fruit bought in July, which is not a surprise since that's a great time to buy fruit in California. But the other items, oops, I'm going to go back here. But the areas, the dark green vegetables and the dark, the orange vegetables, some of those remain very low. And we were promoting this. We were promoting these with recipes, demonstrations, and in the with the families every month. So it still didn't really have much of an impact on those other items in the household, despite the education that we were giving. And my postdocs also, just to give you an idea of what kinds of choices they were making, bananas and apples are the biggest choices that they're making. There are other items there. You can see some of the Latino foods coming in, the cilantro, the chili peppers, and so on. But there's a good number of foods that are very similar to what the African American population in Texas, when I looked at these lists. And then coupled there's some additional fruits and vegetables that are much more popular in the Latino population. Now, interestingly, we also have scanner data from these we have skin carotenoid data from this same population, and we're not seeing a difference in skin carotenoid levels in the children in the intervention group versus the one that's in the control community. So the choices that they're making, either they may not be high carotenoid choices, or the children may not be eating those foods. They may be eating mostly the bananas and the apples, and the other foods may be going to other family members. We have more analysis that we'll be doing on this data set, but I think it might just shed an idea of what the adult, in this particular population, what an additional amount how it might be used. Now, I wanted to also reach out to a few other states because I wanted to touch on some other issues that I think are important. And Oregon WIC program shared some interesting data with me from about the redemption of their baby food. Now, this has already been a theme that's been mentioned earlier about redemption of baby foods. And this was interesting because they have a whole list of language spoken, and that's not the best indicator, but it'll give you some idea across the board how different kinds of populations are responding. However, for the jarred baby food, fruit and vegetables, the percent not spent is about 30%, and it varies a little bit across the groups. The Russian immigrants spend more than some of the other groups, but it's fairly similar for the other language groups served in this WIC population. But as this was highlighted in the last session, the percent of the jarred meats not spent is very high. It's more than 60%. And it could be a little different, again, across some of these groups. Again, the Russian population using more of them and some of the others using less. The Oregon WIC program also has begun to issue some cash value vouchers to the older infants, and is beginning to see that increase over time and becoming more popular for their older infants. So I think it looks like the flexibility in the vouchers is something that may help with that issue. Now, by this point, I was beginning to form opinion of what some of these issues might be. And I decided to circle back around and talk to another state, and was able to talk to Georgia WIC last week and just ask them what kinds of cultural issues do they observe in their state, in another part of the nation where there might be a larger African American population, a different group. And what they told me, let's see, that the most common problem that they were seeing, most common complaints or most common calls to their office were about the switch from the whole to the lower fat milks. And then they were also getting many calls about why there weren't more fresh produce options for the older babies. And like this has been highlighted recently in the last talks, they're also having difficulty accessing some of the foods, the breads and the juices that are not in the standard package sizes. And some of these things may be more important in the smaller towns where there's issues with the perishability. Okay. I'm finished, right? Time's up. Okay, well, I was going to end that there are food choices that differ by race and ethnicity. The switch to the lower fat milks has probably posed a lot of challenges, but we have to ask a question of whether we're consistently delivering our promotional messages about the benefits of these to all of the groups we serve. Is it just a cultural food issue, or is it how the nutrition education is being released? Redemption for the baby foods is an issue. And finally, the selection of fruits and vegetables probably also varies by ethnicity and race, but there's good overlap, and that seems to have been a good way to honor different cultural preferences. And our preliminary data on the Latinos suggests that if the voucher were higher in cost, they would be producing probably more fruits, and maybe something else would need to be done to get the vegetables up. And that's the end of my...
Any clarifying questions from the committee? Okay, let's move on to the last speaker of this session then.